Hi everyone, in this week's episode of The Dish with Denise, we are going to do a story time. So grab your comfy clothes and your blanket and your favorite stuffed animal and snuggle in, and we're going to go through the first step guide from the Amputee Coalition. If you haven't gotten this, I highly recommend it. It's chock full of so much good information in here. If you do have it, but you haven't read it, I'm going to go through and talk about a couple of key points that I love about it, but I'm not going to go into detail, so you can go back in and read it later on. This is an amazing resource for any new amputee and or existing amputee that wants to learn more about resources available and tools to help them along their journey. I am part of the Amputee Coalition Scientific and Medical Advisory Committee, and so I was honored and privileged to be part of the work group that created this newest edition, which came out in 2020 actually. So let's get started with our story today. If you're reading First Step, it's likely because you or someone you love is starting a new journey navigating limb loss or limb difference. We've written this guide for you. First Step is your guidebook to navigate your limb loss or limb difference journey. Chapter by chapter, we walk through the process, from preparing for surgery and choosing a prosthetic device to managing pain and staying healthy. There are even specific sections just for parents, children, and caregivers. You'll read the personal stories of people just like you who made the same journey you're starting now. In the back of this booklet, you will find additional resources, including a glossary of medical words and phrases you may hear, helpful checklists for meetings with your healthcare team, and more. So as you can see right here, here's the table of contents of what is included in the First Step guide. This is a good resource to look at because you might not want to read this from beginning to end, but just find the particular section that you're interested in learning more about. So in here we have Chapter 1 is the journey begins with you. Chapter 2 are the stages of your journey. Chapter 3 is all about pain and pain management. Chapter 4 is staying healthy. Chapter 5 is your emotional journey. Chapter 6 is living well with limb loss and limb difference. Chapter 7 is for the caregiver's journey. And Chapter 8 is for your child's journey. And Chapter 9 is the glossary and appendix and resources. So let's begin with your journey. There are many roads that bring each of us to the limb loss journey. Some people may begin their journey suddenly due to infection or an accident. For others, it may be planned as a way to manage health challenges such as diabetes, vascular disease, or cancer. And some people welcome it if they suffer from chronic pain. No matter where your journey begins or why, we all follow a similar path. This guide will explain what milestones will come along your path, and it will offer tips, insight, and information to help you get the best care for you. So one of the things that's really cool about this is we put sections in it called BYOA, which is Be Your Own Advocate. At the end of each section, you will find these boxes that highlight ways you can advocate for the best care for you. We hope these boxes will educate, inform, and empower you to take the reins of your rehabilitation journey. Throughout this book, you're also going to find personal stories and tips on how to communicate with your healthcare team. Let's jump ahead now to the stages of your journey. So here we're going to list what the typical journey might look like in the different stages you're going to go to as you begin your life living with limb loss. Stage 1 is preparing for the road ahead. Some people might have this book or resources before you have your amputation, and these are great resources to have before you have that amputation. Here in Stage 1, you might meet your surgical team and rehabilitation teams. This can help you plan for your rehabilitation and prepare for prosthesis or other assistive device, should this fit with your goals. Stage 2 is surgery. Stage 3 is rehabilitation. Stage 4 is device decision making. Stage 5 is rehab with your new device. So let's jump ahead here a little bit. And let's talk about before your surgery. Before your surgery, you're going to want to meet with your clinical team. This is a good time to meet with your a prosthetist, surgeon, and a caseworker to see what your journey might look like. If your surgery is planned, discussing the details with your healthcare team, including your surgeon, physiatrist, therapist, and prosthetist, can help you feel more comfortable and prepared for surgery. And here are some great questions to ask before surgery. After your surgery, here are some typical things to expect. The first thing we're going to talk about is pain. Surgery is a significant physical trauma immediately after amputation surgery. You will likely experience post-surgical pain from having your skin, muscles, nerves, and bone cut. This pain can be quite intense, and it's important to try to stay with or ahead of the pain. Pain control after amputation is crucial. Pain can slow your recovery and result in a longer hospital stay. Be sure to inform your nurse or surgeon if the pain you are experiencing is not tolerable. Everyone experiences pain differently. Pain tolerance levels are different from patient to patient, so it makes sense that each patient's pain control options will differ. Depending on your needs, controlling your initial post-operative pain may only require repositioning yourself in a cold pack, or it may require medications, massage, and other techniques. Nerve pain, however, often does not respond well to traditional pain medications. Instead, nerve pain is often treated with anti-seizure medications or antidepressants. These types of medications work by changing the chemistry of the nerve to stop the pain or by blocking pain signals to the brain. Some people who have nerve pain or sensations after limb loss will opt to remain on a pain medication for the rest of their life. Your residual limb may be quite swollen after surgery, and some level of swelling can be expected, sometimes up to a full year after surgery. Your clinical care team may prescribe an anti-inflammatory drug to help reduce the swelling if you feel like the swelling is contributing to your pain. The big muscles of the residual limb can react to pain by spasming, which can generate additional pain. If this is the case, your surgeon may also prescribe a muscle relaxer. Your wound healing. Initially, you will likely have sutures or staples at your amputation site to help close your surgical wound. These are usually removed between 2 and 4 weeks after surgery, depending on your healing process. Wound healing can be affected by other medical conditions or procedures. If you're going through chemotherapy and radiation, your wound healing may be slower than usual. Likewise, if you have complications from vascular disease or diabetes, your healing process could take more time due to slower flow of oxygenated blood to the healing site. So while the typical time frame for healing is 2 to 4 weeks after surgery, there are some things that can contribute to extended wound healing process. Swelling at the incision site and the residual limb can slow the healing. Minimize swelling by elevating the site of the surgical incision, applying compression, or using ice packs. Smoking can also inhibit the wound healing process. Diabetes and vascular diseases, as well as poor nutrition. One of the common things that you have to think about after your amputation is contractures. Contracture is the tightening of soft tissues that limit joint motion. A contracture occurs when muscles and soft tissues become stiff and fibrous from lack of movement. Contractures can make it difficult to wear your prosthesis, make it difficult to walk, and may increase the need for an assistive device like a walker. Most contractures are caused by not moving joints enough. After a lower limb amputation, lying in a hospital bed with the head of the bed up and hips bent up or pillows under the knees may cause contractures at the hips and knees. It just depends on your level of amputation. So if you're a below the knee amputee, then you want to try and straighten out that lower leg as much as you can. If you're an above the knee amputee, you want to make sure you stretch out that hip joint as much as you can. Similarly, lying in bed with the elbow bent up and resting on the chest most of the time may result in a contracture at the elbow. How to prevent contractures. Prevention is the best approach for dealing with contractures. There are different types of exercises for different levels and location of limb loss. If you've not received information about contracture prevention, stretches, or exercises, ask your healthcare team which are best for you. After you've gotten all this information and you're ready for discharge, you may be discharged to your home, to an inpatient rehabilitation facility, or skilled nursing facility. If you are returning home, you will be given instructions for wound care, pain management, follow-up appointments, and when to call for help. If you do not feel comfortable returning home after surgery, ask to speak to a hospital case manager so that you can discuss your discharge options. A rehabilitation facility will provide you with daily intensive therapy to prepare you for a successful return home. Data has shown that being discharged to a rehabilitation facility or a skilled nursing facility can improve your overall outcomes. So in this section here, the Be Your Own Advocate is talking about your discharge instructions. Ask for specific discharge instructions on the care of your wounds, contracture prevention, shrinker sock and ACE wraps, and pain management techniques. There are two very important protocols that you can follow: contracture prevention stretches and using a shrinker and or bandages. Developing contractures in your amputated limb can prevent your ability to use a prosthesis. Make sure you ask your healthcare team for information about stretches and exercises to prevent a contracture from developing. Using ACE wraps and or a shrinker sock helps to decrease swelling and shape your limb in preparing it for the use of a prosthesis. It can also help alleviate some post-surgery pain. It is up to you to follow these protocols to optimize your limb during the healing process. So you might be wondering what a shrinker sock is. This right here is a shrinker sock. And what it's made to do is it's a tight material, stretchy material, that is made to compress your limb. So you want to make sure that the shrinker that you get is tight enough to help compress your limb, but not too tight to cut off the circulation. You also want to make sure that as your leg shrinks down, you might need another size of a shrinker sock to help keep compressing it down. As we mentioned before, it's good not only to compress the swelling and get it shaped into a nice shape and get ready for your prosthesis, but it also can be used for sometimes those phantom sensations or pains. Sometimes having compression on it can help with those. So I've been an amputee for 31 years and I still use my shrinker when I don't have my prosthesis on, just because I like the way it feels, and having that compression on there I feel kind of helps with some of those phantom sensations that I have. So this is a good thing to ask your prosthetist for. And because it's super tight and snug, you might have a hard time getting it on initially. And if you do and you find it's too hard to pull on, ask your prosthetist, because there are devices out there that help with donning or putting on your shrinker sock. What to expect in rehabilitation. It is important for you to be engaged with your team and learn as much as you can about your medical circumstances, your limb healing, recovery exercises, and benefit versus risks for using a prosthesis and or other assistive technology. You have to outline your goals with your medical team. These goals can include independence, safety, mobility, or education on limb loss and limb difference. Remember, you are the center of your rehabilitation team as you navigate this journey successfully. As you begin your rehabilitation, protecting your residual limb will be a top priority. This means keeping the skin healthy, preventing the limb from rubbing against or bumping into surfaces, or taking unnecessary risks during rehabilitation and recovery. While this may feel like you're being held back, the cautious pace of this phase helps you achieve your recovery goals and allows you to connect with your prosthetic device and or other assistive devices outlined in your care and recovery plan. During this phase of rehabilitation, you will discuss with your healthcare team which assistive devices will be the most helpful for your mobility and safety. They will train you how to use them to navigate everyday environments. Candid conversations with your team, especially asking questions or expressing concerns, is vital to your success. Remember, this process is about you. Earlier on, I mentioned some of the the helpful tools that are in the back here, and I just wanted to take the time right now to share those with you. So in the back here, we have a medical health history form. This can be helpful when you are sharing information between all of your providers. Another tool right here is your follow-up appointment worksheet. So if you want to, if there's any changes in your healthcare, in your treatment plan, or your medications, this is a good tool to utilize, that you can write it all down to be able to share between your prosthetist, your surgeon, your PM&R doc, your physical medicine and rehabilitation doctor, your primary care physician, or your physical or occupational therapist. Here's a great tool if you have not decided, if you do not have a physical therapist assigned to you through the hospital or through rehabilitation. Here's a great tool right here of questions to ask a physical therapist or occupational therapist to make sure that they are experienced with working with people with limb loss or amputation, because it is a very specialized therapy. You want to make sure that you're going to the right person. Also, if you do not have a physical or occupational therapist, you can ask your prosthetist or your rehabilitation doctor who they might recommend, because they'll know what physical therapist or occupational therapist in the area is skilled with therapies for people with limb loss. Also in here is a prosthetist interview. So here's some great questions to ask a prosthetist to make sure that you are selecting somebody that is going to align with your needs and your goals, and is experienced in your level of limb loss. Before you go home, if you feel like you might need any home assessments or modifications, you can ask the physical therapist or occupational therapist to come and do that for you. There's also a great resource here in the back that does a home assessment for you of some things to think about. So these are all here in the back of the first step guide, but I also have them on my website at thedishwithdenise.com. So it can be easily downloadable for you.